Okay.
All right, so I've already come in, done my hand hygiene. I have given my patient privacy. I've checked his armband and verified his identity by his name, date of birth, and told him the doctor's orders were vitals and a couple of assessments, so we're gonna get started on the assessments. So first, we're gonna do your respiratory. So do you have any shortness of breath or any heaviness or anything that you feel?
Sometimes I cough.
Sometimes you
It's, they're little coughs, but it's a very dry kind of thing.
All right, and do you have any mucus that comes up or anything like that?
And not too much, it's mostly a dry cough.
All right, good. So earlier during the vitals, I recorded his respiratory rate at 18 beats per minute. It was unlabored, and we call that eupnea, so he's good on that front. I am gonna auscultate your lungs, so I'm gonna just take a listen. And normally I would do this underneath the clothing, but for the video purposes, we're doing it over the clothing. So I'm gonna start here on the left side, left upper lobe. When this touches, breathe in, breathe out. All right, right side upper lobe. Right side middle lobe. Left side lower lobe. All right, and if you'll sit up for me and just move your arm this way, I'm gonna listen to right here. Right side lower lobe. Okay, and same thing on the other side. Left side lower lobe. All right, now I'm just gonna listen to the posterior side of the lungs, so I'm gonna listen to the back. Same thing, breathe in, breathe out. Left side upper lobe. Right side upper lobe. Right side lower lobe. Okay, and left side lower lobe. All right, all that sounds good. So if you were to have a cough with mucus, I would educate you on, if you're bedbound, I would tell you to turn to the left, take a deep breath, cough. And same side, or same thing with the right side, turn to your right, take a deep breath, cough. And then I'm gonna educate you on an incentive spirometer. So we're gonna just use
I'm not,
a banana.
not using.
You don't actually have to use it, but are you familiar with one of these?
Actually, I am.
Okay, well, I'm gonna tell you anyway. So you're gonna exhale, you're gonna put your lips around the mouthpiece, form a tight seal, and then you're gonna take a deep breath, inhale, hold your breath for like 3 to 5 seconds, and then blow out. And I encourage you to do that about 10 times an hour. It's very hard to do, so maybe do it like 2 to 3 times during your commercial break. Now, do you understand what I just said?
I do.
All right, perfect. And now we're gonna move on to the cardiac assessment. So I'm gonna take a listen to your heart, evaluate your legs, all that. So you would pretend you're in a hospital bed, about 45 degrees. I'm gonna assess for edema, starting on the lower extremities and working my way up. Good, then the upper extremities. All right, we're good. And then if you'll just turn this way, I'm gonna take a look at your neck. All right, no jugular vein distension on this side. And no jugular vein distension on that side. Now if I could just see your fingernail, I'm gonna assess for capillary refill. All right, and his perfusion is good, 2 to 3 seconds. And I'm gonna assess a couple of your pulses, make sure everything's good. We're only gonna do 3 today, but normally we could do the carotid, just never both at the same time. Your axillary, I think that's how you say it. Your brachial on both sides, radial, femoral right here, popliteal behind here, posterior tibial right here, and dorsal pedis on the feet. So today I'm just gonna do your radial pulses. All right, we got 2+ bilaterally. I'm gonna do the inside right here, posterior tibial. 2+ bilaterally. And for video sakes purposes, we're gonna do the dorsal pedis. 2+ bilaterally. All right. So good on that. Now I'm going to listen to your heart. And do you have any chest pain or anything like that? No? Okay. All right, so we're gonna start on the right side of the heart. at the second intercostal space, which is the aortic artery. And I would do this underneath the clothing if it was normal situation. And then over here, second intercostal space at the pulmonic artery. Third intercostal space at Erb's point. Fourth at the tricuspid. And then the fifth intercostal space, mid-clavicular, is the mitral or the aortic or the apical pulse. And S1 and S2 are all present. And if I heard something unnatural, abnormal, I would use the bell side of the stethoscope to listen, but everything sounded pretty normal for me. So that's the end of the assessment, I believe. Did we cover everything? Yes. So now I just want to go over some safety tips and fall risk preventions, okay? So have you had a fall in the last 3 to 6 months?
No,
Okay, and do you use a walker, cane, anything like that, or even furniture?
well, sometimes when I stand up, I'm a little.
Little orthostatic,
But
Well,
I
you take
stand
your time
there
and-
and I wait and then I'm okay.
okay, and, let's see, what else? You're not on any IV therapy?
No.
Do you need assistance going to the restroom?
Nope.
All right, so you're good on that. So before I go, I just wanted to make sure, before I would leave the room, I would make sure I covered all 4 Ps, which are make sure you went to the bathroom, made sure his bed's lowest position, make sure you have all your personal belongings, and what is the other one? And make sure you're not in any pain, which earlier in the vitals, he did have a little bit of pain, but it's in the documents. So, yeah, before I go, just wanna make sure you have a clean, just some safety advisements, make sure you don't have any cords loose so you don't trip over yourself. If you have any dogs or kids, make sure there's no toys around. You have a call at your cell phone, if you need me, you'll just use that to,
My kids are grown.
okay, good. All right, so do you have any questions for me?
No.
All right, thank you so much.